Good afternoon, everyone. We'll just wait another minute for everyone to join and we'll get started. Okay. Good afternoon, and welcome to our fourth office hour session addressing QAPI. Everyone has a role and responsibility. I am Joanne Skinner, Quality Improvement Advisor with the Health Quality Innovation Network, or HQIN. I am joined today by Mary Childs, who is President and owner of Childs Healthcare Consulting. Mary is an RN, RAC certified, and a QAPI certified professional. She supports facilities across the U.S. to implement systems that will enhance compliance and regulatory requirements and improve outcomes. I am also joined by our HQIN team of infection preventionists and quality improvement advisors. But first, a few housekeeping items. Everyone is currently muted and in listen mode only. If you have a question or would like to comment, please use the Q&A icon at the bottom of your screen. All attendees will be able to see the questions and responses. If for some reason we're unable to answer all of the questions during the session, we will follow up afterwards. If you would like to ask a question or comment live, please click the raise your hand icon and we will unmute you so that you can ask your questions. At the end of today's session, there will be a short evaluation link posted. We'd appreciate you taking a few minutes to complete that so we may better serve you in the future. This presentation is a visual resource for how to establish a successful QAPI program. Today we will demonstrate how to utilize the tracking and trending of your data to work through a sustainable action plan utilizing your QAPI process. This office hours can be used to educate your team and in combination with our last 3 sessions to support your survey readiness or response to a POC or a DPOC. As a reminder, HQIN members will automatically receive a link to this presentation and other resources after the session. If you are not a member, we invite you to join. Please contact your state's Quality Improvement Advisor. They will be listed at the end of this presentation. QAPI and sustainability. Leaders need to determine if the interventions and changes they are making are sustainable. Often interventions need to be reconsidered. Once data is collected, do you analyze the opportunities? Even if you've made improvement, you want to analyze if there are trends identifying continued opportunities. Leaders must go to the frontline staff to capture the real issues in a team-building way, looking at patterns in staff, shifts, units, or departments that may lead us to new root causes and need for new interventions. The more whys we answer, the more root causes we will note and be able to respond to, the more likely you are then to sustain your change. So you have identified an area of opportunity. Since mid-March, your facility has implemented masking for all employees while in the facility, unless eating. Through auditing, you have identified a pattern of opportunity with laundry attendants while in the laundry room. A PIP was initiated, one-to-one education was provided, but ongoing observations are indicating 40% compliance. I will now turn the presentation over to Mary Childs, who is going to lead us through the next steps.
Thank you so much, Joanne, and thank to each of the participants in today's session. We know that time is something that is truly valued. We appreciate your time of joining us today, but we also wanted to take a moment to just simply say thank you for all that you were doing to care for your residents, to care for each other, and to care for your families during this trying time. In today's session, we're going to explore how accountability plays a critical role in each element and in each step of the QAPI process. We're actually going to look at this model, and we're going to explore each of these steps and see how one step leads into the next. So Joanne, if you'll move the slide to the next one. Opportunity. As Joanne defined earlier today, you have identified an opportunity. Your job has been done. The new opportunity was identified, and we now must explore, form a hypothesis, and do something with that newly identified opportunity. You recognize something did not work, but what and why? Next slide, please. So now that we have the opportunity identified, this is where we begin to build upon the trends. To discover why the implemented process did not achieve the desired results, you first have to analyze those trends of data that was collected. And you realize as you begin to analyze it that more information is needed. We would encourage you to explore both commonalities and variables. As Joanne mentioned, was there a relationship to the time of the day, or the personnel or team member that was involved, or was there certain circumstances that repeated themselves as you looked across the multiple observations? As you explore and examine the trends, you are having to prioritize them, and you find that it is easier for you to do that if you categorize them into certain groups. This will allow for better drill down. Sometimes the analysis of the data is going to lead you to explore needed system changes, either new ones or modified ones, and others simply mean that you have a new opportunity to explore a different way of approach, perhaps to an individual or to a smaller group. For example, if the data revealed that a number of staff in the laundry were failing to wear their face mask while in the laundry room, you would need to explore if there was commonalities among the personnel that were resulted in them wearing their mask. However, if the analysis revealed that Mary was the only employee in the laundry that did not wear her mask while she was in the laundry room, your opportunity is to explore with Mary, to have that first round of accountability, to understand why she did not wear it, and to solicit her input on how to solve the issue that she has, or the concern, or the reason why she did not wear it, that would then lead to better compliance. In the same scenario that we talked about earlier, the data demonstrated some key findings and answers to some of our preliminary questions. Was there a trend of times when the laundry observations were made? Was there a trend the laundry personnel that was observed? Were the audits being conducted by different personnel? So as we began to look at those categories, we realized that we had some key information. For example, Mary was the only person in the laundry room who had been observed but was not wearing her mask while in the room. This analysis also included that other people understood what to do. So now we know that we need to figure out why was Mary not doing what was expected. And yet, we also knew that Mary had been observed wearing her mask when she was outside of the laundry room. For example, when she was delivering clothing to the residents, or she was stocking the living room. This information made you wonder what was different about being out and when she was in the laundry room. We also happened to know, because we had reviewed related data indicating that Mary had participated in the in-service training. So you did not think that it was a matter of her not understanding something. We also knew, based upon the assignments for the auditing and the monitoring, that these audits had been conducted on 2 different shifts and by different personnel. So we had realized that Mary worked the second shift and that she was the only employee in the laundry during that shift. Again, why didn't Mary want to wear her mask while she was in the laundry room? Although the observational audits had been done by 2 different team members, you quickly interviewed them and you realized that they were using the same approach for conducting the audit, and they were using consistent application of their findings. And this was a key piece of information for you. So Joanne, let's move to our next slide, and let's discuss the first step of accountability to self. So the first step in reviewing the data is to explore accountability of oneself. That doesn't mean that you've done something wrong, and it certainly does not mean that you have not done your job. What it does say to you is that you have to candidly critique yourself. You need to think about things such as, did I really understand the original root cause? Was the implemented plan responsive to my understanding of that root cause? Do I really know that the plan was implemented and that those changes and expectations were communicated to team members in a manner that they understood? Is there additional factors? Is there something that I possibly missed that would have an impact on the outcome and why our expectations are not being met? This leads us to our next slide, which now we're going to talk about accountability to others. Now, given the scenario that we've just discussed with Mary, and how you have analyzed the facts and the data that you've been collected, we now have to explore accountability to Mary. And when we begin to have accountability to others, we encounter multiple barriers. It's just part of who we are. Some of these barriers that are very common for us is we're crossing over departmental lines. I'm not their supervisor. Or perhaps the hardest one to overcome is they really don't pay any attention to what I say. They just think I want to get them in trouble when I say they are not doing something correctly. As we begin to drill down and look at the first key of accountability with others, it has to do with approach. It requires a sensitivity and requires respect. It requires that we create a balance of how we are going to approach, address the situation, and a balance of how we do it in a manner that engages and encourages an active solicitation of information. We have to treat the other people as though they are partners in helping us understand, partners in helping us to explore solutions. Now, many of you have worked in organizations or health systems that embraced a concept called just culture. Now, we're not going to brand just culture, but just culture by any name is a concept that focuses on values and commitment of the organization and its employees to ensure that we treat everyone fairly, that we want to be able to make sure that we have systems that are responsive when we have adverse resident or patient outcomes. It's critical that we have these systems in place so that we can explore them. It builds upon our environment that fosters transparency and engages staff in process development. Accountability to others is more than just a policy or a step within a process. Quite frankly, it's a way of interaction and communication that demonstrates how an individual or the organization's response is to responding to an identified opportunity and seeking system changes that are going to be sustainable for compliance. It's ongoing and it's embedded in the very essence of everything that we do. In the scenario that we have discussed so far, you are now at the point of accountability to others. In this scenario, you need to obtain more information from the employees doing the audit and from Mary, who is the laundry worker. When talking with the personnel who conducted the audits, it may be prudent to speak with both of them and have them explain how they approach and how they responded to and documented their audit findings. You want to be sure to strive for consistency in your approach and consistency with how the audits are being observed and the conclusions of the audits. So for example, if a staff member needs prompting or cueing during the variable that is being observed, it should be coded as the criteria not being met. But at the same time, we have the opportunity to note what we did. And we would, in that case, provide one-on-one education or demonstration to the staff. As we begin to approach Mary, who was the person that we felt was not being compliant with the expectations, we have to be extremely careful that we do not approach her in an accusatory manner, but rather one that clearly seeks her input for understanding by you and discussion with you about possible solutions that will change her actions, that will result in better compliance. Now, I'm going to give you two examples, and I would like for you to just pose and think to yourself, if I were Mary, which one of these examples do you think that you would respond to better? Mary, you know you are the reason that we did not meet our goals this month. Something has got to change, or we're going to have to write you up. Now let's review that expectation again. Or would it be better, perhaps even with a little quieter tone? Mary, I need to understand why you do not choose to wear your mask while you are working inside the laundry room. Let's explore that together, and let's explore what can be done so that you will wear your mask while you are in the laundry room. So Joanne, if we can move to the next slide, because in the next slide really helps us to understand a little bit about the importance of drilling down and engaging and talking to Mary, and understand more about why Mary is choosing not to do what has been expected. In the book called Coaching for Improved Work Performance, Ferdinand Forney has a section in that discusses 16 different reasons why employees don't do what they are supposed to do. And this is prime for the situation that we have given you today, because actions are a form of behavior, and behavior is a form of communication. So we have listed some of the examples on the slide that you're seeing. That person doesn't know what they're supposed to do, or they may not know how to do it. They don't know why they should do it, or perhaps they think that it is being done correctly and nobody has really told them before what should be done differently. The reasons go on and on. Now, you can purchase this book as a whole. It's a great book from most of your local bookstores, or you can purchase it through Amazon.com. I would encourage you to take an opportunity to look at the handout that is going to be sent to you along with this presentation, because HQuinn has taken these 16 possible reasons why somebody doesn't do something and put it in a format to help you explore ways in which to be responsive. Next slide, please. So now we are at the root cause. As you talked with others, you gathered more information. You gathered information from the two auditors. You have now gathered information from Mary. You validated that the two people conducting the audits were being consistent in their approach and in their interpretation of findings. You learned why Mary did not wear her mask while in the laundry room. She explained to you that she worked there alone during that shift, and she did not believe that she had to wear the mask if she was not in contact with others. She knew what she was supposed to do when she was around residents or other employees, and she understood the need to wear the mask at that point. Mary also shared with you that she was the only person to work that second shift in the laundry, and that was the hottest time of the day, and that it was frequent that the temperature in that laundry room would often be greater than 90 degrees. She also shared that she had been told that she could not use the fan while in the laundry room because of infection precautions. And it was just simply miserable for her. When it got to be over 90 degrees, it was very difficult for her to breathe with that mask on. So that leads us to our next slide, which is now going to be the slide that talks about taking action. So as you concluded, and you have talked to Mary and the others, we now have to do something different. And two opportunities have arisen in this scenario. The first opportunity is looking at system changes, because you did not recognize earlier how hot the temperature could get in the laundry room, and the fact that it could become miserable for anyone to work in that environment with temperatures above 90 degrees and to wear a mask at the same time. So what are you going to do about that? The second scenario is a personal one for Mary, because she did not clearly understand the importance of wearing that mask while she was alone in there by herself. So now we need to educate Mary. So we have to decide what we are going to do. In the first scenario, the fact that we failed to recognize how hot it got, one of the considerations for changing your system was that the facility agreed to install a small air conditioner, and they created and positioned the air conditioner in a manner that would not blow the air directly across the linen. Mary was educated one-on-one about the importance of wearing the mask even when she was alone in that laundry room. And Mary not only validated her understanding, both verbally and by her action, she said, I will do it. She gave you a commitment. I will do it now that we have the air conditioner. This leads us to our last step, and we're back at the beginning of evaluating and monitoring to know whether or not the new system change and the education that we have given to Mary is going to effectively promote greater compliance. So now we're going to start our audits all over again. We're going to wait until the air conditioner is installed. And as we do the audits, we're going to make sure that we include Mary in those observations of the audits that are being done on that second shift. But when I talk about including Mary, that means that I have a new opportunity. I have first an opportunity to give her feedback. Thank you, Mary. Glad to see that you are wearing your mask. Our second opportunity is to provide feedback to Mary regarding her sharing the fact that it was too hot in that room. Thank you, Mary. I see that the air conditioner is working. Are you having any trouble? Is it more comfortable for you now when you are wearing your mask? I really appreciate you sharing that with us. That type of feedback solicits further engagement and brings us back to the whole cycle of continuing to monitor. So Joanne, again, thank you for this opportunity. I hope that this example is something that can resonate with our viewers, and I'm going to turn it back over to you.
Thank you so much, Mary. We appreciate a great presentation. As a reminder to HQuinn members, you will automatically receive these resources on this slide after this session. If you are not already an HQuinn member, here are your state contacts. You can reach out to them and they will assist you in joining and make sure you receive today's resources. Also, we ask that you please complete the evaluation. And most of all, like Mary, HQuinn thanks you so much for taking time out of your busy schedule to join us today. We appreciate your commitment to your residents, your families, and your facilities in these stressful times. We will now open up the floor for a Q&A session. If you have any questions, please put them in the Q&A icon at the bottom of your screen. Or if you would like to ask a question or comment live, click the raise your hand icon and we will unmute your line. Allison, do we have any questions?
So this is Deb. I'm not showing any questions in the Q&A, and I also don't see that anyone has their hands raised. So you ladies that was a great example. It was a very good presentation. Thank you.
Okay. Well, thank you everyone for joining, and if there are no questions, we will end the session.
Don't forget to give us your feedback. I just put that link in the chat for your feedback. Thank you.
Thank you, Deb. Thank you, Deb.